the richest Prime Minister in British history, who's over there in number 10 Downing Street. And so I think people out there know whose side they're on, and they know who cares for them. And it's these workers, it's certainly not Rishi Sunak or his Conservative pals. Well, we're here outside 10 Downing Street, protesting in support of the nurses who have taken strike action today to protect their pay, but also to protect the National Health Service, which is at real risk at the moment from this Conservative government. Well, the government needs to take today's strike action seriously. People don't go on strike lightly, and nurses have gone on strike because they feel there's no other option in order to save pay terms and conditions, but also to save our National Health Service. In Parliament, there's Conservative MPs openly in the House of Commons chamber talking about moving towards a United States of America style insurance system for health. You know, we don't want our health service to be changed into a system where they feel for your wallet before they feel for your pulse. And what we're seeing now is a crisis in our NHS, and the Conservative government are trying to use that to manufacture consent to finish off privatising our National Health Service. This year, we mark the 75th anniversary of the founding of our NHS. We've got to make sure it's still here for its 80th birthday. An NHS which is fully in public hands and run on the basis of the founding principles of our National Health Service.
Do you think there's an element of management maybe the Tories will hope we'll get to a system where it's so bad that we can only go private?
I think we need to be clear. I think the Conservatives want to use this crisis in our National Health Service as an opportunity for them to wreck our National Health Service and instead push people towards paying for their health care. They want to push people into such a situation of desperation where they grudgingly feel there's no other option than to start paying for this, paying for that, manufacturing consent for privatisation, manufacturing consent for turning our health service into a USA-style healthcare service where they feel for your wallet before they feel for your pulse. We can't allow that to happen. The NHS has faced crises throughout its history, but make no mistake, this is the biggest crisis in the history of the NHS, and the Conservatives, the hard right-wing ideologues in Parliament who don't believe in the founding principles of our NHS are wanting to use this crisis to push people into accepting the full privatisation of our National Health Service. So the National Health Service is just left there almost as a safety net at the very bottom. They want to do to our National Health Service what they really did to council housing, where it went from being a mass provision for people to a provision for a minority of people in society, and we can't allow that to happen.
What would you say to maybe some of your constituents who might think that the NHS is unsafe on strike days?
Well, sadly, the NHS isn't as safe as it should be on any day, really, and that's what nurses and doctors and ambulance workers are telling people. And that's one of the reasons they've gone on strike, because they don't think that the government is listening. They're saying that they're struggling day in, day out to actually give people the care, the urgent care that they need. And the government haven't listened to them. The government haven't put in the proper funding that they should be putting in to turn that around. And so NHS workers have felt there's no other option other than to go on strike. It is an NHS emergency. And the people who my constituents trust to care about our NHS aren't the Tory ministers, but are the nurses, the doctors, the ambulance workers.
We're moving towards a National Day of Action on the 1st of February, where quite a few unions will go on strike. Where do you think this fever is coming from, that workers are now demanding better pay?
Workers are fighting back because they've got no other option. Workers have been forced into strike action because we've got the biggest cost of living crisis in living memory. And working class communities and working class people are coming together through their trade unions to fight back because they have no other option. You know, we know that there are food banks in hospitals. We know people are struggling to make ends meet. We know that people in what would traditionally be considered pretty well paid, decent, stable jobs are struggling to make ends meet. That's not right. And we're one of the richest economies in the world, and people who work in our hospitals, in our schools, on our railways are struggling to pay the bills, are struggling to make ends meet. But for those at the very top, the billionaires, they've been doing very well. So it's no wonder that workers feel it's necessary to fight back. And so we need to give political support to them in their industrial fight back, because they need results now. They need saving from this cost of living crisis now, and it's through their collective action that they'll save themselves from this cost of living crisis.
Do you think that unions they're getting back what they had in the 70s when we had that whole union baron narrative that the Tories are still trying to push now? Do you think that's sort of melting away? Do you think people feel differently about unions than maybe they did 10 years ago?
The Conservatives have introduced this anti-strike legislation in Parliament the other day, but I think they've really misjudged the public mood. People on the side of the nurses, of the ambulance workers, of the doctors, of the railway workers, of the teachers, because they know that they're people from their community. They're the people who look after us when we're sick. They're the people who educate our children. They're the people who get us to work or to see our loved ones. And that's in a big contrast to the richest Prime Minister in British history, who's over there in number 10 Downing Street. And so I think people out there know whose side they're on, and they know who cares for them. And it's these workers. It's certainly not Rishi Sunak or his Conservative pals.